I think with some further training in specific areas, it can make a huge impact. 60% of the nurses that work in Native communities are Indigenous or Native American, but they don't have a 60% voice, right?
The other thing that I firmly believe is in human-centered design, and that is, are you framing your problem correctly? Is it a problem, but through the eyes of your end user?
We are taught from the beginning not to deviate from off-label uses on supplies, on equipment, on procedures, on treatments, and they're right. We cannot deviate from that. But that is not to say that we cannot innovate in areas that we do see a healthcare gap that needs to be addressed.
And I think as a nurse, what I really value is that one-on-one time where I'm there for the patient and I'm just listening to my patient. And I think that can transcend into so many different avenues, whether that's public service, whether that is CEO of a healthcare organization where you're listening to the needs of the people. It's so important. And I think that nursing philosophy, which is so important, we just need more nurses that are in those positions of power. So if you're out there and you're listening, you can do it.
But we know that regardless of how we look at diversity, or what makes a person diverse from the main population, it's only going to benefit everyone involved and the way that we approach and deliver patient care.
Living through the last year, regardless of what one person's political stance or feelings are, a lot of the students are hurting, and they need space to have that conversation or not have the conversation. But acknowledging their grieving is important. Acknowledging that what they see every day is a part of their reality. All of those things matter.
Nurses are the most trusted profession in America, have been for decades, and that trust only went up over the last year. And trust is the bedrock of our democracy. And so as these challenges are coming up that could impact how easy or hard it is to vote, we need even more the trusted messengers like nurses and like doctors and social workers to be helping patients get that last little mile to be able to vote.
Racism is a root cause of much of the inequity in healthcare. And we know that for so many reasons, but now there's abundant research evidence, there's abundant anecdotal evidence from people's lived experiences, and we know enough to move forward.
Science without humanity will never equal quality care.
And what's so relevant now is it feels like a race. It feels like the race between variant-driven surging, like we're seeing in Michigan, and how fast can we get vaccine in arms.
There's nothing special or different about trans kids. There's nothing inherently wrong with trans kids, especially. Trans kids, like all kids, thrive when they are supported and affirmed. It's just kids in general need to be supported and affirmed. And we know that trans youth without supportive parents really, really harms mental health and increases the rate of suicidality.
It makes me feel like I'm less alone. I think one of the things that I first struggled with was not being sure of was the right way to feel, and having all these different thoughts and not being sure if they were almost the right thoughts to have or the right feelings to have, or were they even valid. And then even though it's sometimes difficult to share with others, being able to share these different thoughts together makes me understand these thoughts are very valid and it's okay to feel certain ways at certain times.
Amplify Nursing is hosted by Dr. Angela Rosa DiDonato and Marion Leary, and produced by the University of Pennsylvania School of Nursing, with special thanks to our Department of Information Technology Services for their assistance. Music for the podcast was created by Harper Leary. The podcast is made possible by the Krista and Rich Pinola Fund for Innovation in Nursing.
Follow us on Twitter @PennNursing. Until next time, keep pushing over, under, around, and through.